do you know about pain? Usually I tell you to ask me questions, but today I'll be the one asking you some questions. If you watched my videos or read my book, you will know the answers to these questions. I prepared 10 questions for you. Get a paper and pencil and take notes of how many correct answers you get. At the end, I'll show you a link that you can download a document with these questions and test your friends. I'll ask you a question and give you 5 seconds to think of an answer. Then I will review the correct answer. Let's start? First question. When we eat chilies, the brain releases endorphins, a type of endogenous opioid. True or false? It is true. Capsaicin is a chemical substance in chilies and it activates the same pain receptors for high temperature. So because your brain thinks that our mouth is being burned through a heat source, it doesn't know if the mouth is being burnt or not, and it releases powerful painkillers. Maybe some people are addicted to chilies. Well, that I don't know, but we know that 2 billion people eat chilies on a regular basis. And check my video about capsaicin here. Number 2, phantom limb pain is when pain goes away after the limb is amputated. True or false? False. Actually, it is the opposite. Phantom limb pain occurs after the limb is amputated. The person feels pain in a part of the body that doesn't exist anymore. This is because the pain is coming from changes in the brain. It is the same mechanism of tinnitus, the ringing in the ears that happens when a person has hearing loss. When the brain doesn't receive information anymore, like no sensations coming from a limb or no sounds coming from a ear, the brain will create these sensations, like the sensations in the amputated limb or the sounds in the ear that has hearing loss. Check my video about phantom limb pain here. 3. Herpes zoster and postherpetic neuralgia are types of pain, neuropathic pain that is caused by the chickenpox virus. True or false? It is true. A person that had chickenpox will carry the virus for the rest of their life in the neurons of their spine. If this virus reactivates, they cause zoster. And if the pain of zoster persists for more than 3 months, this is defined as postherpetic neuralgia. Watch my video here. I tell my story when I had zoster in 2019. Number 4. Our brain processes pain, but it cannot feel pain. True or false? It is true. The brain does not have pain sensors on itself. That's why a person may have a stroke and does not feel any pain. This is different from headaches and migraines. Headaches are usually caused by the structures outside of the skull, like the muscles, tendons, or the peripheral nerves, like the trigeminal nerve or occipital nerve. Migraines are a type of primary pain, that is a dysfunction of the pain system, like a nociplastic pain. Watch my other videos about headaches and migraines here. If you're enjoying this video so far, don't forget to subscribe to this channel and turn on the notifications so you can be alerted when I post new videos here. Number 5. Some people have a rare genetic disorder that they are unable to feel pain. True or false? Yes, actually this is a very rare disorder called congenital insensitivity to pain. These people don't feel pain and they get injured, diseases or lesions, and they don't protect themselves. Because of this, their lifespan is shorter. So being able to feel pain is a good thing, it protects us, but that's true for acute pain, right? Not chronic pain. Chronic pain actually does not protect us. It's just a noise that irritates and steals joy and quality of life. Number 6. Pain that persists longer than 3 months can change the brain. True or false? True. Pain that persists for a longer time starts causing changes in the brain. That is why people with chronic pain like fibromyalgia, CRPS, migraines, chronic pelvic pain and others, they have difficulty concentrating, their mood is affected, and their sleep is poor. Watch my video here about central sensitization. Number 7. Pain tolerance is dependent on genetics and cannot be modified. True or false? False. Pain tolerance is influenced by genetics, but also many other factors like the gender of the person. We know women have lower pain tolerance than men. It's also influenced by mood. When the person is depressed or anxious, their pain tolerance is lower. Watch my other video here about this. And please remember that this video is not intended to give medical advice. If you have a condition that is causing pain, talk to your doctor for a diagnosis and individual care plan for you. This video is for educational purposes only. If there is a medical emergency, please call an ambulance or go to the nearest emergency department. Number 8. Some types of food can make pain worse or better. True or false? True. There are various nutrients and vitamins that are associated with chronic pain. For example, vitamin B12 deficiency can lead to peripheral neuropathy, and this may lead to chronic neuropathic pain. Watch my other video here about vitamin B12. There are also some foods that fight inflammation, for example, essential fatty acids like omega-3s and omega-6. Watch my other video here. Magnesium, vitamin D are also helpful to reduce pain, especially muscle pain. Check my other videos about them. Number 9. The majority of people with fibromyalgia are young women. True or false? False. The majority of people with fibromyalgia are middle-aged women. About 80% of people with fibromyalgia are women. In the United States, there are about 5 million people with fibromyalgia. This is a type of nociplastic pain, and it's associated with fatigue and sleep problems. Watch my other video here about fibromyalgia. Did you get a copy of my book, The 8 Steps to Conquer Chronic Pain, a doctor's guide to lifelong relief? It can be ordered anywhere where books are sold. I combined 30 years of experience as a pain doctor, scientist, and professor of medicine, and I wrote this book to teach people like you. I think if you have chronic pain, you deserve to have the knowledge to conquer it. And the last question, question 10. Persistent back pain is a sign of a serious tissue damage. True or false? False. We know that if a person has persistent back pain, this is rarely a sign of a serious damage. It's also not a sign of poor posture or getting older. Persistent back pain is mostly caused by muscle tension and psychological stress. Watch my other videos about back pain here. So how did you do? Here is the link for you to download these questions. Well, write down in the comment section below how many correct answers did you get. Did you learn something new today? What was it? Stay safe. Goodbye.